There we go. The first one is the amygdala. Now, this plays a real central role in mediating anxiety. In the limbic system, this is deep in that primitive part of the brain, and it warns us when danger is present. This is where that fight, flight, or freeze response comes in. That's the sympathetic nervous system. And again, you see with children, they can get very angry and upset. They can get very fearful. They want to run away. That's the amygdala being hit. Some research has shown that very anxious children tend to have an amygdala that's larger than their same age peers. So children who have high levels of anxiety as compared to their same age peers has an enlarged amygdala volume, as well as increased connectivity with areas of the brain in charge of attention and emotional perception and regulation. If you think about this, this looks a lot like ADHD, which is why kids who sometimes look like they're inattentive or they're emotionally dysregulated, a lot of people might say, oh, maybe they have ADHD, you should get them checked, but it's not, it's anxiety. There's also the central cortex, the hippocampus, and the locus coeruleus. The central cortex evaluates information about threats and then makes judgments about them. The hippocampus helps us process emotions and long-term memories and pairs the two. And then the locus coeruleus determines which information is important. So all of these are affected, or anxiety, all of these are affected by anxiety, and anxiety, they mediate anxiety. So those are just little parts of the brain that anxiety taps into. There's also the neurotransmitters like serotonin, norepinephrine, and GABA. Serotonin helps regulate moods such as aggression, impulse, sleep, appetite, body temperature, pain. If the serotonin levels are low, a child may feel anxious. Same is true with norepinephrine. It affects the body's sympathetic nervous system. That's that fight or flight. And it affects sleep, mood, blood pressure. If these levels are imbalanced, the child can suffer from anxiety. And then GABA. It helps prevent a child becoming overexcited, helps with relaxation, going to sleep. If the GABA levels aren't high enough, a child might be prone to anxiety. So you can see that anxiety is not simply behavioral. There is this genetic and neurobiological underpinning to anxiety. And this is true of adults. This is true of children as well. There are lots of other factors that are true when it comes to anxiety that we have to look into. So anxiety there is a genetic component to it. If a parent or a close relative has a mental health disorder, there is questions regard to the low socioeconomic status. That's a bit controversial. Exposure to trauma, being inhibited or shy can lead to anxiety, and being female 2 to 1, we're finding, also has a higher rate of anxiety. When we're talking about young children, especially smell, like when you smell the doctor's office, you don't even have to go, you can smell it, and then you're like, oh no. Touch, sight, and situations all can be triggers for young children for anxiety. When we're talking about real little kids, we're talking about separation anxiety, and this is common in very young children, and it absolutely is developmentally appropriate. We don't have to treat separation anxiety if we expect it in a child of that age, and if it doesn't interfere with their everyday functioning. We treat it when it interferes with developmentally appropriate functioning. So we're looking for inappropriate or excessive fear or anxiety when the child is separated from the person that they're attached to. If the child can't function and we expect them to, and again, here's where a professional would come in. I don't always expect, a 7-month-old to be able to separate easily. I don't expect a 2-year-old to separate too easily, but at 5, I do expect them to be able to separate. So that's when we start looking to treat it, although we certainly can work with younger children than 5. When we're looking at separation anxiety, a child must have at least 3 things: extreme distress separating or thinking about separating from the home or from the parents, extreme and persistent stress about losing the parents or parents being hurt, extreme and persistent distress thinking about something happening that would make the child or the parent separate. Again, it doesn't have to be real. A lot of this is perceived. And persistent reluctance to leave their safe place for fear of separation. We're talking about fear of being alone, fear of sleeping alone in a house or in a bed, nightmares regarding possible separation, and then those psychosomatic symptoms when separation occurs or is anticipated. This fear has to be persistent and last at least 4 weeks in children. It has to cause clinically significant distress or impairment in functioning, and it can't be explained by a medication shift or by any other sort of disorder that's going on. So that's where rule-out diagnosis is very important. When the child gets older, now we start looking at social anxiety and shyness, and they are two different things. Social anxiety is an intense, persistent fear of being watched or judged by others, and it has to affect work, school, and day-to-day activities, including making and keeping friends. And the person has to feel this way at least 6 months. When we're talking about shyness, the tendency is to feel awkward, weird, worried, tense during social encounters, especially with new people. You will get physical symptoms when you're shy. These are more like blushing or sweating. Again, those central nervous system cues. And then there are negative feelings about themselves, possibly. They worry about how others view them. There might be a tendency to withdraw from social interactions. But the impairment of functioning is what we treat. And we look at the intensity of the fear and the level of avoidance. If the child is simply shy, but they function fine, we don't necessarily have to treat it. And maybe we need to look at whether we as parents are more uncomfortable with it than the child themselves. As long as the child is able to function and function, relatively well, we don't necessarily have to treat a shy child. But when they're unable to separate, and they're unable to leave your side, and they're unable to attend school or any other sort of program, that's when we start looking at help. Along with separation anxiety or social anxiety, these go hand in hand. Generalized anxiety disorders, a specific phobia to something in particular. But all of these tend to boil down to fear of separation or fear of losing a parent, fear of stability. We're also looking at attention deficit hyperactivity disorder. We're looking at autism, oppositional defiant disorder, which often goes hand in hand with ADHD, and depression. So all of these disorders tend to go hand in hand with anxiety. When we look at young children who are anxious, they often physically manifest their anxiety because they don't have the language to process what they feel. So all they know is that they feel off, and then they tend to act out, which might look like attention deficit disorder. It might look like aggression, but in fact, these children are anxious. It might look like over control, but these children are anxious because they just simply don't have the language to be able to share with you what their concern is. We're going to see behaviors like flailing, hitting, kicking, screaming, biting, any sort of ritualistic behaviors, touching things, chewing on things, having a specific nubby that they like. We're also going to see those flight and freeze behaviors, right? Where they chew their nails, they chew their clothing. Again, all of these are ways that the child believes to decrease their anxiety. So when we work with children, we have to know that each child has a different set of complex behaviors that they show, and they may not be consistent. They might change over time. What we're looking at is that the behaviors that we're seeing serve the same function, which would be a reaction to the real or perceived threat and the avoidance or escape of that threat. So just because the behavior changes doesn't mean, it means that that behavior didn't help with the anxiety, so the child is going to switch to another behavior. So we have to look at the underlying function of the behavior. So what can parents do? So the role of the parents is not to create happy children, and that's so important. Our job is not to put forth happy children into the world. Our job is to teach our children to be able to learn to function in the real world. And from that functioning comes happiness. But we as parents need to teach our children to tolerate and be comfortable with being uncomfortable. So it's really important that we practice what we preach. If you say you need to go take a break and calm down and then turn around and throw something or hit something when you're upset, the child is not going to listen to what you say. They're going to watch what you do. Your children are aware of everything you say or do. So when there's a significant change in your behavior, the kids feel it. The other important thing to remember is that even if you don't think your children are aware of what's going on, they know that their base is unstable and they don't know why. So they're more likely to act out if you're uncomfortable and if you're stressed and upset, because they don't know why you are. They just know that their base is uncomfortable. When we speak to kids about anxiety, we always want to use appropriate words for feelings. We never want to hide it. We never want to say it's not important. And we want to model appropriate coping mechanisms. I walk around often with a large cup of water, and I ask my parents why I'm walking around with water. And it's because you can't yell and take a drink at the same time. It'll get all over the place. So it's so important to walk around with that cup of water. And when you get upset, take a drink. It's a built-in pause to allow yourself to collect yourself so that you can then go on and deal with what you have to. The other thing that's important is to ask for help. If we can model that for our children, they will learn that it's okay to ask for help. When a child is having a big emotion, oftentimes we don't know what to do. Our job as parents, as psychologists, as therapists, is to try and catch the child before the big emotion catches the child. Because once the child is in the midst of a fit, the only thing that's going to stop that fit is time. So it's important to be able to teach the children how to handle what's going on before their emotions take over themselves. We want to always identify emotions with a name. Oh, it looks like you're angry and frustrated. We want to be able to listen and paraphrase back. Oh, I got it. You're telling me that when your brother takes your toy, it really makes you crazy and angry. I see. You don't have to agree with them, but if they feel heard, their anxiety levels will decrease tremendously. There's a technique in meditation called noting. That's when you acknowledge and recognize a thought, a feeling, anything like that. And that's it. It's like inviting somebody to the party. You don't have to do anything with them. You could say hi. You could acknowledge them. I'm so glad you're here. I have to go get something from the punch bowl. I'll be back. And you walk away. The same is true with these thoughts and feelings. If we can teach children, and we can, to note their feelings and not interact with them, not get caught up in them, then those feelings tend to go away within usually 90 seconds. Again, we want to acknowledge their feelings, acknowledge their thoughts. They are real, but we don't have to do anything with them. And it's very important to teach children that you can be uncomfortable, but nothing bad is going to happen to you. Learning to be comfortable with being uncomfortable will go a very long way in decreasing that anxiety. The most important thing with children is to remain calm, because the more upset you get and out of control you get, the more space you give the child to get upset, and they will. When a child is self-harming, we have to stop the child. That's true if the child is self-harming or harming other people. So if a child is going to go after a sibling, our job is to protect that sibling as well. So if a child is engaging in serious self-harm, our job is to prevent it. We don't want children scratching themselves, pulling out their hair out of frustration, ripping their skin, ripping their clothing. That has to stop. So the very first thing we have to do when it comes to self-harm is to make sure that the child and everyone around the child is safe. Again, before the big emotions take over, we want to give the child an alternate and effective behavior to engage in. And when they do engage in that behavior, we want to give them accountability and praise for it. I see that you did that. I am so proud of you. Thank you so much. When we do that behavior, it gives the child permission to engage in that alternate behavior as well. And that's really important. Again, we're modeling appropriate and effective coping mechanisms for the child. And when we get upset, the kid gets upset. So it's really important to remain calm. I'm a very big fan of mindfulness, and I've been able to teach it successfully to children as young as 3 years old. So here are some programs and books, as well as apps that I really like, geared to children of all different ages, to help with mindfulness. Mindful Schools. Lori Light has books, CDs. I don't think she yet has podcasts, but the moment she does, I'll be all over those. Thich Nhat Hanh has some wonderful children's programs. Go Zen, they have cards, they have online programs. They're little videos that explain anxiety, that explain OCD, positive thinking. Mind Yeti is another wonderful program. Go Noodle not only has programs for dancing and for movement, for yoga, but also for meditation. And they're all guided, they're all very short. And we always want to be able to teach kids the emotional language so that they have the words to use to explain themselves. Here are just some apps that I really like for kids. Smiling Mind is wonderful. They have more than one age group to work with. Buddhify also is wonderful. Yoga for Kids, Headspace is my favorite, and Stop, Breathe, and Think. There's more than, one or two. These are just the ones that I use most of all. When it comes to pandemic parenting, which is different than other parenting that's going on now, because we're all in this crisis. The whole world is in this crisis. So what are we looking at? We're looking at seeing signs of depression and anxiety in all walks of life, especially in children. Again, children have no idea what's going on. They have some idea of what's going on. They just know that their world's been upended. Turn off the television. There is no reason to hear it. There is no reason to see it. We're giving them information that's beyond their developmental level, and there's no reason for these children to engage in that. What we do want to do is tell the truth and give these children developmentally appropriate information. So we always want to give them the truth, but in a way that they understand. And we want to encourage and give suggestions for self-care. So although this is a really nice tip sheet for teens, it doesn't just go for teens, it goes for everybody. The more we have a daily routine that's consistent sleep, consistent activity, consistent food, consistent study patterns, the easier and the more comforting it will be for the child. We want to try and stay connected with others and find moments of humor. I know that sometimes we feel like our kids are attached to the screens, but right now it's about moderating screen time, not pulling it away, because they can't engage any other way but screen time, and we don't want to separate them from their peers. We want to let them talk to people that they're comfortable talking about their feelings, their worries. It's okay to worry. It's okay to be concerned. And it shows strength when you ask for help. But it shows even more strength if you're able to do something about it. And so we want to encourage them to speak about their concerns. Again, limit the amount of time that you spend talking about or watching social media, news, not around the children, because they don't understand and they're going to be seeing things that are beyond their developmental level. And give permission to yourself to be kind and patient. You're a human being. You have concerns and stressors, and it's important to know that you're fallible. And if you're kinder with yourself, they will be more understanding, not only with you, but with themselves as well. And that will also decrease the anxiety. Just really quickly, when it comes to a psychologist, what we're doing to diagnose is we're observing and listening to the child. We want to know what the child tells us. We want to listen to the teachers, to the parents, what everybody around us has to say about the child, because they all see the child in a different situation and venue. They know the child differently, and it's important to hear what everyone has to say. So here are some questions to keep in mind. I want to see how the child reacts when they enter my office. I want to see when they see a professional, do they stop? Do they turn around and look at mom and dad to check and make sure they're safe and okay? How soon do they let go? I have an entire wall that's like floor to ceiling toys. How soon do they go over there, or are they attached to the child, to the parent's hip? Do they constantly seek validation or insurance from the caregiver? And I want to see what's maintaining the behavior. I was friendly with a mom and her daughter, and the child would try and walk into preschool, and the mom would be biting her nails and all nervous and would saying, "It's okay, you can go." And so then the child would start to cry, and then the mother would start to cry. And it was this back and forth thing. And I said to the mom at one point, if you just turned around, gave her a hug and kiss and left, this would be gone. Like, she wouldn't be that upset. And she kind of poo-pooed me, but it's true. If the parent is maintaining that reaction in the child, then that's important information that we need to know. As well as if the child gets a lot of attention when they're anxious and upset, then the child's going to continue to be anxious and upset. So we have to moderate that as well. We have to look at when the parents accommodate children regarding their anxiety. We want to make sure or see what is maintaining or validating or increasing the anxiety in the child. So all of these things are what we're looking at when a child walks into our office within the first few minutes. Here are some scales that help differentiate. This is not an exhaustive list. This is just a few of them that we as psychologists use to differentiate between anxiety, ADHD, depression, some other comorbid disorders. Some of them can be used as early as 1.5 or 2 years old, so we can start with children that are very, very young. When we're looking at treatments, studies have shown that CBT, which is cognitive behavioral therapy, is the gold standard for reducing anxiety, especially when it's combined with parent training. There is some more controversial information when it comes to parent training and questions regarding parent training. So we don't want random parent training. We really want specific parent training on how to help the child through it. But if the parent themselves is over anxious or overly protective or doesn't consistently meet the child's needs, that's going to increase anxiety in the child, which is going to increase behaviors. And the focus of the treatments are incorporating systematic desensitization in a developmentally appropriate framework. We want to model behavior within a developmentally appropriate framework. And we also want to do exposure exercises, which is exposure and response prevention, where the child learns to practice coping skills rather than avoiding anxiety-producing situations. So I'm going to put you in the anxiety-producing situation, but I'm going to hold your hand, and then I'm going to slowly back away. So I'm not holding your hand and you're doing it all by yourself, where you can, where the child is able to use their skills and their strategies. I'm sorry. When we do exposure and response prevention, there's a hierarchy of fears. So we're going to sit down with the child and we're going to say, what's the thing you're most afraid of? Now, what are you afraid of? And where does that go? Is it higher than the first thing? Is it lower? And now tell me another thing that you're afraid of. And is that in the middle? Is it lower? Is it higher? So we can build a list of like 10 things max that the child is afraid of. And then we work within that hierarchy. That hierarchy is not stable. That hierarchy can change. But we want to expose the child to their fears without allowing them to engage in any behaviors that are going to decrease their anxiety. Because the more you live within that anxious situation, within a therapeutic setting, the more you're able to use your coping skills and the more your anxiety will decrease in the long run. We also have quite a few manualized treatments for anxiety. These are some, again, they are not exhaustive. We have the coping cat, coping koala, creating opportunities for personal empowerment. And there's another newer one called Thinking and Doing Equals Daring that they're working on within the Netherlands. And manualized treatments sometimes get a very bad rap, but they're wonderful places to start. So when we talk about parent training, although there is some mixed research involving parental involvement decreasing anxiety, what we're finding is that we need very targeted programs for parents. It's not just random programs. But we're going to see that childhood anxiety is more common in families with anxious parents. So there is this familial transition, be it a learned behavior, be it solely behaviorally moderated, or be it genetic. It's probably a combination of all three. One of them is the SPACE program, which is supportive parenting for anxious childhood emotions, which targets the parent-child relationship and family accommodations. Another one is called PCIT, and that also is real life, like having a bug in your ear when you interact with your child and the psychologist says, oh no, now I want you to go practice and do this particular thing. So that in real life, when your child is doing something in the therapist's office, the therapist is able to guide you to more appropriate behaviors. And lastly, there's also medication. So it's not, medication is never a no. But sometimes we need medication to decrease the anxiety so that the child is available to learn the skills that they need so that eventually we can get them off the medication. A lot of the anti-anxiety medications like benzodiazepines or antidepressants are used to treat anxiety. There are side effects to these medications, and a psychiatrist is going to have to weigh what the side effects are with regard to the positive outcomes. Again, sometimes we're talking about a low dose over a short period of time, just so that the child can learn the skills that they need to learn. And then this is my information. Oops. So if anybody has any questions, they are more than welcome to contact me.
Amazing. So thank you so much, Deena. That was so helpful. I see that there's already a question in the chat. So Emily just asked, do you have any everyday coping mechanisms that we can teach our children for low-lying anxiety? So things like being spooked when your child watches TV or reads books, and nightmares. So yeah, that would be an awesome question to start with, and then I'll get started on the other ones that the parents have submitted during the registration.
Sure. So it depends. With regard to the nightmares are developmentally appropriate. And sometimes the nightmares, we want to make sure that children are able to go back to sleep after nightmares. So we're always looking at setting up an appropriate sleep routine and sleep habits for children. When it comes to watching scary shows, if we're talking about something that the child theoretically should be able to watch, like a cartoon that's not, again, that's developmentally appropriate, I probably would remind the child that it's okay, that they have control over whether or not they watch it. They don't have to watch it, and it's okay to get up. But if they really, really want to, we can help them by giving them praise for sitting through until the next commercial break, or taking a pause, pausing the show, taking a breath and continuing on. How long can we go until we pause it? Those sorts of things. Humor is wonderful, especially with young children. So if we can engage in humor with the kids, that will help them find humor in situations as well.
Awesome. I know you mentioned that separation anxiety and kind of like social situations are two kind of common challenges. I wondered if you could maybe get into slightly more detail about how parents can actually, help their, I suppose if it doesn't rise to the level of potentially clinical issue. Now kind of how parents can help with that, especially since separation anxiety is potentially more of an issue after children have been at home with parents for longer.
Yeah. And that's really tough. We're going to find that with our pets too. We're going to go back to work at some point and our pets are going to be like, hey, wait a minute, you were here all the time and now you're not. So the more that we can set up a routine and a safe space for the children, the more they can feel in control of their world. And the calmer we are, especially when the separation when that separation anxiety is going to start because the pandemic is over. No, I'm so proud of you. You're going to school. This is going to be so exciting. I know it's a little nerve-wracking. That's totally nervous. Okay, I'm nervous about going to work too. So giving them permission to be nervous, but not to have it impact their functioning will go a very long way to help with that new separation anxiety.
You also mentioned...
But those routines are very important. Those routines are very important.
Yeah, that totally makes sense. The other thing you mentioned was around giving attention for anxious behaviors and how parents might be potentially like inadvertently encouraging those behaviors. So are there ways that that when you do notice your child is getting anxious, like what you should be doing? I know you mentioned a few steps around, naming the emotion and helping them take a break and all of that sort of thing, but it would be great to just kind of recap that, like when you see that your child is starting to get nervous in one of those situations, how to make that happen.
When your child is screaming, if you can talk to them while they breathe and they're taking a breath. So they're screaming, and then they go, oh, and you go, hey, Hey, you're good. I can talk to you. And then they start screaming again and you go, I'll wait. They will very quickly learn that in that pause, in that silence, you will interact with them. So that's an immediate stopgap thing that you can do when a child is out of control, if they're willing to let you. Again, this does not include self-harm or anything like that.
Yeah.
But if a child is screaming and having a fit, if you must speak to them, it's always best to be able to let them have the fit and talk to them when they're done. And as long as you can turn away safely, then that would be the best thing to do. But if you can't, talk to them in the pause. I had a child I was working with who at 8 stopped eating, and she really was meeting the clinical guidelines for anorexia. And the dad would sit there and he would go, come on, you have to eat. Come on, what's wrong with you? Come on. And meals were taking like 2 hours, 3 hours. She was very young. I said, stop paying attention to her when she's not eating and engage in conversation or games or whatever we're doing. As long as that food is in her hand, in her mouth, chewing and swallowing, then we can engage. But when everything goes down, we're not talking to her anymore. So we really want to pay attention to the behaviors that we would like to shape.
No, that totally makes sense. And so around the like fears and that sort of thing, I'm imagining just the number of times, you know, your child is afraid of the dark and you're like, well, there's nothing to be afraid of. You know, are there certain things like that that, you know, parents should be looking out for, like that it, even for example, in the TV show example, you know, it was just a nightmare, you know, that sort of thing. Are there kind of like lines, or how do you sort of validate that emotion and at the same time, you know, like help them walk down from it?
So going back to routines are so important, be it waking up because you're afraid of the dark, or how to go to sleep because you're afraid of the dark, or mommy left the room so you're afraid, or I had a nightmare, so now what? Going back to that bedtime routine and starting the routine again, not from brushing your teeth and showering and going to the bathroom, but maybe from taking the breath, from rubbing the back, only for a few seconds, for turning on a radio or something just so that there's background noise, whatever it is that your bedtime routine is, doing the bedtime routine again, especially ones that the child can do themselves without help, will help the child self-soothe and get back to sleep earlier. When it comes to being afraid of the dark, there's no reason not to have a nightlight, unless, of course, the nightlight is so bright that it impacts the child sleeping. That's not appropriate. But we can slowly decrease the light in the room so that the child is getting used to staying in the room by themselves when it's dark.
And then are there ways of kind of like involving your child in actually putting together that routine? So for example, you know, maybe a radio works for some, maybe like leaving the door open a crack works for some, maybe a nightlight works for some, but is it kind of trial and error? How do parents sort of like figure out where to start with those routines, but then how to potentially change them as they try it with their children?
Nothing is set in stone. So any routine that you create or any therapeutic intervention that you create has to be flexible enough that you can change it. And the more rigid you are, the more rigid the child is. So that's really important too, because they're looking for boundaries that are stable, but they're also looking for a warm, safe place. There are certain things that we don't have to include we don't have to get their buy-in for. You must wear clothing. You cannot go to school naked. It's not an option. I don't care if it's 30 degrees and you want to wear shorts. That's on you. You'll be cold and you'll learn that. But you still have to wear pants if you're going to school. So there are certain decisions that we're not leaving up to the children. And that's really important to let them know, because they're looking for somebody to give them that guidance. They're looking for someone to take control. That being said, if we can get buy-in from the kids for most things, you're more likely to have success with an intervention. So if you say, listen, you're afraid of the dark, what do you think will help? They may say, I have no idea. I don't know. In which case you go, no problem. I got it.
Yeah.
But they may not. They may turn around and they say, I feel more comfortable when the door is open. Great. We're going to learn how to shut the door, but we're going to do it very slowly. Let's pick the calendar. Let's start the day. We'll circle that date. This is the day we're going to keep the door open, and this is the day we're going to slowly start to shut it, and here's how we're going to start to shut it every day, and I'm going to be so proud of you when you wake up, and blah, blah, blah. If you do it X amount of days in a row, you get whatever it is you decide, be it an extra book at bedtime, be it dessert for breakfast, one time won't kill a kid, but they'll remember it, and that's an external motivator that would be very strong.
So I'm seeing this question on the chat right now that says, how do we support a child who's anxious about going to school because of past negative experiences? So yeah, I would love your thoughts on that.
It really depends on what those past negative experiences are. And if possible, if we can get buy-in, help from the school, that would be ideal. Children must attend school, especially now we're seeing so many mental health issues come up because children are they don't always have access, both socially and academically. So having children in school to have that social interaction and to learn we're finding so much more important than we even thought for so many reasons. We need the buy-in from the school because sometimes we have the kid come into school for an hour a day and then we leave. And sometimes, and then we go to an hour and a half, and then we go to 2 hours, and then we go until lunch, and then we go until right after lunch, and we slowly reintroduce the child back to school. It depends on the severity of the problem.
And then I'm seeing another one around what looks like somewhat of an intense challenge where it says, I'm not a parent to an anxious child, but they have a child in the nursery who's displaying high anxiety and is really afraid of other children, and how we can help her start interacting with others. And this child has been with their nursery for nearly 6 months and has only slightly improved. So any advice on helping children start to interact with others? And feel free to say, this needs to be something that's referred on and, whatever. But
so it does need to be referred on. I can tell you in New York State, we have something called Committee on Preschool Special Education. And that sounds like a child who might qualify for someone called a SIA, which is a special education itinerant teacher, which is somebody who comes into the preschool setting or the home setting to one-on-one help the teachers and the students. What we're looking is to set up a reward system for the child, even to interact with other children slowly. We also want to know what's going on with the child and why they're not. Did they not get enough sleep? Are they hungry? Is something else going on? We want to rule all of those things out as well. But we want to create a routine whereby the child gets rewarded for developmentally appropriate behavior.
Yeah, so it sounds like rewarding the things that you want to see is certainly a theme here. And then also routines have been a theme that I've been hearing. And then so another more specific situation we got during the registration was specific to the pandemic, that their child is screaming they want to go home when they visit an outdoor space after 73 days in lockdown. So so I guess I guess this has to do with what you were saying, even with like leaving the door open little by little, but how do we kind of ease kids back into these sorts of situations that they might be more anxious about now than they would have been before?
And it's certainly idiosyncratic to the child. I certainly have children in my own house who, as soon as pandemic's over, they're going to say, I'm out of here, bye, I'm gone. So they're more than willing. They don't need any help getting out. But there are those children who are very comfortable sitting at home and being with mom and dad, and don't understand the science behind the vaccines, the science behind what's going on in general. There's so much going on. It's about reassuring children that mommy and daddy are safe, and will never put you in a situation that's harmful, and we are going to stay here for X amount of time, and I expect you, even if right now we're at the park and you're sitting next to me, that's okay, and we're going to stay here for 15 minutes, and then we're going to come back and we're going to stay for 20, and then we're going to come back and we're going to stay for 30 minutes, but I want 5 minutes of those outside on the playground, to slowly give the child the expectations, and to then, even if it's verbal praise, reinforce it. We can't expect a child to act in a certain way, especially a child who's highly anxious and aroused, if we don't explain to them what the expectations are. So that goes back to making sure you have appropriate communication with your children.
So yeah,
we don't have to tell them everything, but we do have to let them know, I expect you to be able to sit outside with me for 5 minutes. It's okay. And that goes back to the exposure and response prevention as well.
Yeah. And how do you know you're pushing your child kind of the right amount? Is there like a sweet spot there that we're looking for?
Every kid is different. I was working on a hierarchy. I have a therapy dog that I work with who comes into my office, and another therapist asked to borrow the therapy dog. You're only allowed to work with the therapy dog is only certified with their particular handler. So I, of course, come in with my therapy dog, and it's 2 therapists, therefore 1 dog and 1 child. And the child is afraid of dogs. But the hierarchy changes all the time. The child comes in and he goes, here's my hierarchy today. And we go to work on it, and sometimes he goes, no, I can do that. This is much easier. So we're going to move it from a higher place in the hierarchy to a lower. And sometimes the child says, I thought I could do this, but I can't. It's really much scarier. So we move it back up to a higher spot in the hierarchy. And I guess the answer is it's idiosyncratic to each child, and it's got to be flexible. Because sometimes kids are overtired and they just can't do it. And sometimes it's a great day and they feel like they can push through and they want to do one more session or one more try again or sit through another show. And so you've got to be able to be flexible in that.
Awesome. I'm looking at another question on here of a child who has ASD, ADHD, and dealing with sibling rivalry, unfairness, and different rules and reward schemes between siblings.
So I think that that's a much more involved conversation.
Okay.
Yeah, that's much more involved. On one hand, it is important to teach children that life isn't fair, and it's about being appropriate for each child. But those are 2 very specific needs for the children, and I think handling that would require another conversation, a separate conversation.
Makes sense. I'm looking at a few things. There's a few questions around just kind of how you differentiate between a child who's quite sensitive versus a child that really does need clinical support. And then other questions around how you know that a behavior is kind of motivated by anxiety versus maybe something else. So maybe if we could,
Yeah, there's something called Yerkes-Dodson law. Yerkes-Dodson law that says if you have no anxiety, nothing gets done. Right? If everything is chill and everything is calm, then there's no motivation to do anything or to change. On the flip side, if you have too much anxiety, you become paralyzed and you can't function. So it's about finding the sweet spot for anxiety. We don't treat all anxiety. We don't. I was just going to say, I was terribly anxious about coming on. It didn't stop me from attending today. I still have to attend. I still have to do my best. I still have to, show up, and that's okay. So not all anxiety is going to be treated. We can acknowledge it. I know that makes you nervous. I know it's scary. I am so proud of you for doing that. High five. You get a big hug for that. So when we treat anxiety in young children, and the same is true in adults, it's when it impairs a child's functioning. If a child cannot go to school, if a child cannot do their work, cannot participate in activities that they wanted to, even if they said they wanted to do it and then they started and they said, I can't do it anymore. When it impedes someone's functioning, that's when we have to treat it. Right? If a child is stressed because all of their clothing bothers them and they can only wear 2 shirts, we might want to treat that.
Sounds like, and no, that totally makes sense. So it sounds like also you're kind of praising and encouraging bravery, almost like you're encouraging your child to kind of confront those fears as well, and I guess using your judgment about how much is the right amount to push your child to do that.
And everybody knows their own child. So what might be right for one child on one day is not going to be correct for another child on another day, or that same child on another day.
Yeah.
There's something to be said about that exposure and response prevention. I'm going to expose the child to things that are important, and I'm not going to allow them to engage in behavior like taking off their clothing, get to decrease the anxiety because it's non-functional. The other thing that's important is letting the child know what the expectations are. I'm working with a child now who's 14 who is horribly anxious, who could not even come on camera to speak to me. So every session, mom put the phone right by her, and I said to her, here's what I expect next session. And we went from me talking to her with her mother in front of her, to me talking to her while she was down and the mother was out of the room and she wasn't on camera, to me talking with her while she was bundled, hiding behind her dog, to now I'm able to have a discussion with her where she's facing the camera.
Yeah.
I let her know the expectations every single time, so I'm decreasing the anxiety. There's no question of what's wanted, and once you're able to do that, I give you praise, you don't have to guess, and we move on.
Cool.
So that communication is super important.
And I heard like two sorts of like preparatory things that you said that we parents should be doing with their children, whether that one was mindfulness, and the other was like having those conversations and kind of learning the vocabulary of emotions. And so I guess if you could tell parents like one tiny practice to start doing these things, maybe in a more proactive way, not in so much a reactive way to an anxious behavior, would love your suggestions on that.
Always giving children a vocabulary is important. So making sure that children understand what that feeling is. I don't feel good doesn't tell me what's going on, and I can't help you if you don't feel good. So I want to know, are your muscles tight? Does your jaw hurt? Are you making your teeth really tight? What is tight, like tight, like loose like spaghetti, right? Are we doing strong muscles, or are we loose like spaghetti? We want to be loose like spaghetti. Again, depending on the age of the child and the developmental level of the child. Is your skin hot? Does your stomach hurt? All of those sorts of things, so that they have a way to explain what's going on. I'm a huge fan of mindfulness, and especially of mindful breathing. We make origami boats, and we lay on our bellies, and we put the boats on our bellies, and we rock the boat, and we take really deep breaths, and we practice diaphragmatic breathing that way, so that a child understands how to breathe. And so when they get really upset, we can practice rocking the boat. And if we think about rocking the boat and about our breath coming in and out of our body, we're not thinking about all of those bad thoughts that make us have tight muscles, and that make us really hot, and that make our bellies hurt and our heart pound really hard. So that's important too. Those two things, giving them an appropriate, developmentally appropriate vocabulary, and starting to teach the basics of mindfulness, and recognizing that you don't have to engage in the thoughts.
No, that totally makes sense. I'm looking at I'm just looking at our list of questions to make sure we cover what's left in the last 5 minutes. Okay, so there's one around general anxiety and a pressure to be perfect. So how we can help children potentially get over that kind of pressure that maybe they're putting on themselves or they're getting elsewhere.
It really depends. I was being trained as a classical pianist, and I was being trained for Juilliard, and I have not touched a piano in 25 years because I am terrified of making a mistake in front of people. And I feel like I lost a limb, like there's a real part of me that is missing that. It's okay to mess up, and it's about practicing messing up and knowing that you won't die in the end. That it takes a very long time to get over this idea of perfection, because that's more cognitive than it is behavioral, right? So that's about changing the mindset of somebody, and that requires a lot more buy-in from a child. But if it's a very little kid, we practice making mistakes, and we practice coming through the other side. And if it's an older child, that takes a lot more buy-in, because now we're working on heavier CBT stuff.
Yeah, lucky or unluckily, we are working, Debbie at least, a lot of our audience have quite younger children, like toddlers and preschoolers. So that sounds like something that could be really helpful, both in terms of like helping children also, face fearful situations. And even if they do get scared, or even if there is a negative kind of outcome on the other side, being like, wow, you did an amazing job confronting that. And so it feels like, do you have other suggestions around kind of practicing making mistakes that parents can do with their children?
Sure. I was talking to somebody earlier today, and she was telling me about all the things that were going wrong, and I said, "But this is great." And she said, "I don't understand why you're saying that." And I said, "Because every time that you are able, and obviously this is an older child, but every time you're able to admit that you have a problem and that here's the problem, and you give words to it, you own it, you label it, that takes strength. So I'm acknowledging and thanking your strength. So now we're doing cognitive restructuring, and it's important that we're able to do that." Again, scheduling on the calendar. What day are we going to wear the wrong socks? I'm so excited, and you did it, and that's wonderful. What day are we gonna wear something different or do something different? Today's the day. I'm telling your teacher you're going to call out, and I can't wait. I'm so excited. Let's see what happens. So especially with young children, when we have other people to set up the situation so that it's a no-fail, and the no-fail will be, I'm going to call out, and the teacher is going to tell me, and the child's going to know this, the teacher's going to tell me, nope, you have to raise your hand. Again, that expectation is very clear, and we know what the response is going to be.
That's okay. No worries. We're all in this situation right now. No issue.
And we know what the response is going to be, so that the child is aware, oh, she's just going to tell me to put my hand up, and that's okay.
Yeah, so almost preparing for what happens on the other side too.
Absolutely. And again, this goes back to, and I only said this once maybe, but it's a big theme in the work that I'm learning to be comfortable with being uncomfortable. It's okay that you don't like how the socks feel. We still have to wear the socks. Nothing bad's going to happen to you, and eventually you're not even going to realize you're wearing socks.
And I feel like part of this is also around, setting those expectations and setting them consistently as well. Because if every time you're being told, you know that if you speak out of turn, someone's going to say, nope, we raise our hands, and that happens every single time, then that isn't scary compared to if you're reacting differently, potentially at different times.
Right. Or if your dog is locked in the basement with you while you're giving a presentation, you're terribly uncomfortable and you feel really horrible, and then life goes on.
Exactly.
I didn't die.
Awesome. Well, it's 1:00, and that sounds like it's 1:00 my time. I'm on PST. And so it sounds like that is a perfect way to end, around being more comfortable with being uncomfortable, both ourselves and with our children. So thank you so much for joining us, Deena. As we mentioned in the chat, we'll be sending out materials from this, plus a recording of the session, as well as Deena's contact information. So if you have more questions, we're happy to pass them along. And thank you all so much for joining us. We're really excited to see you at future webinars, hopefully with Deena and others as well.
Thank you.
Thank you so much, Deena.